Good afternoon. I am Kitty London, your host of My Health Matters television program. Today's program is being recorded. This television program is brought to you by Global Health and Community Service Incorporated and the Florida statewide organization of Omega Psi Phi Fraternity Incorporated. Our platinum sponsor is the Quantum Foundation of West Palm Beach, Florida. We would also like to recognize our other sponsors, the TED Center, Healthier Boynton Beach, Truist, Nonprofits First, Epsilon Gamma Omega, chapter of Alpha Kappa Alpha Sorority Inc. of Huntsville, Alabama, and Alpha Alpha Upsilon Omega, chapter of Alpha Kappa Alpha Sorority Incorporated of Wellington, Florida. We would like to extend a special thank you to our production team, C. Ron Allen and Nelonsky Noel of KOP Mentoring Group. That's it, and enjoy the show. Welcome to My Health Matters. I'm your host, Kitty London. First, I would like to say happy holidays and welcome. This is our last show of the year. I cannot believe this. We've had some great shows and I hope you continue to watch us. Today, we will talk about ED, also known as erectile dysfunction. Even though this affects men, it also affects women and the partners of the men who are affected. Before we talk to our medical experts, we have introductions. Please welcome Jeffrey Lakey, Director of Global Health and Community Services Incorporated.
Greetings, and thank you for joining our 9th Health Forum of 2022. It has been our pleasure to bring you a health forums on a variety of topics, such as breast cancer, diabetes and hypertension, mental health, prostate cancer, and sickle cell disease. Today, we present for discussion a sensitive topic affecting millions of people, titled Erectile Dysfunction, Questions, Answers, and Solutions. This is a very important topic since the most common risk factors for erectile dysfunction are heart disease, high cholesterol, obesity, coronary artery disease, diabetes mellitus, high blood pressure, metabolic syndrome, low testosterone levels, kidney disease, and prostate cancer. While ED may get you to the doctor for a checkup, finding out about the risk factors may save your life. Thank you to our doctors who have joined us to present a real and frank discussion about ED. We hope you leave here with solutions and a plan of action as opposed to suffering in silence, guilt, and shame. Finally, thank you to our partner, the Florida statewide organization of Omega Psi Phi Fraternity Inc., for collaborating with us to present these health forums for the public. We hope that you share this information with your family and friends and continue to support our programs. Thank you. Take care.
Thank you, Jeffrey Lakey, for that warm welcome. Now, our next welcome, we have Miss Global Jamaica 2022, Anicia Morgan. Welcome, Anicia.
Hi, everyone. Good afternoon. My name is Anicia Morgan, and I am the reigning Miss Globe 2022, Jamaica. Recently, I returned from Albania, competing in the Miss Globe International pageant. There, I represented my country in a competition, competing of intellectual agility, physical fitness, facial beauty, and knowledge of current affairs. But today, it gives me great pleasure to be here. In a few moments, a team of top experts will share important information about symptoms and treatment options of erectile dysfunction. According to Johns Hopkins Medicine, the prevalence of erectile dysfunction is predicted to be over 300 million worldwide by 2025. After today's discussion, couples and families will feel empowered to speak with a physician and no longer with guilt, shame, or in silence. But before we get started, let's say a big thank you to Mr. Darren Toston, Dr. Louise Hines, and Mr. Persil Pratt for making it possible for me to be here and organizing a discussion on this important topic that affects so many people. Again, I am Anicia Morgan, and it gives me great pleasure to say welcome, welcome, welcome.
Thank you so much, Anisi. It's always a pleasure having you on the show. Now let's get into our experts. Dr. Denise Asufa-Ajay is a trailblazing, dynamic, award-winning urologist and researcher. She attended Carnegie Mellon University and earned a Bachelor of Science degree. Dr. Asufa-Ajay attended the University of Michigan and earned her medical doctorate degree. Urology proved to be the perfect intersection for her passion for surgery, general love for engaging with people, and the unique ability to connect others on this sensitive issue. She is an expert in male infertility and sexual dysfunction. She also currently is the assistant professor of urology of Loyola University, Chicago Stritch School of Medicine, where she serves as the medical director of male reproductive medicine. We would love to welcome Dr. Asufa-Ajay. Our next expert is Dr. Tiffany McCullough. She's a board-certified emergency medicine specialist at Good Samaritan Hospital in West Palm Beach, Florida. She provides care for adult and pediatric patients with acute illnesses or injuries that require immediate medical attention. Dr. McCullough is the immediate past president of the T. Leroy Jefferson Medicine Society. She earned her medical degree at Howard University College of Medicine and has a practice in the medical. She's been practicing in the medical field for 21 years. Dr. McCullough is also the owner of Calogenics, a med spa, aesthetics, and wellness center that provides, among other things, sexual wellness services for both men and women. For men, the P-shot treatment and wave therapy. Both of these wonderful ladies are also active members of AKA. Now, time for commercials.
Vital Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Now let the fun begin. We want to welcome our doctors to the show.
Hi, thanks so much for having us.
Hello, hello, ladies.
Mhm.
Beautiful ladies of medicine.
Thank you.
Now I think this is the fun part. We got all the logistics out the way, who you are, but now we need to get to the topic at hand. So I want to welcome everyone to the show. Dr. Denise, may I call you that for the show, if you don't
That's
mind?
fine.
Okay, thank you. And Dr. Tiffany, may I call you Dr. Tiffany just for the
Of
show?
course, yeah.
Okay, thank you,
Absolutely.
because we have enough tongue twisters to get us through the day. Dr. Denise, let me start with you first, because I always like to start with the basics. For people who are looking at the show for the first time, they hear the acronym ED, which stands for erectile dysfunction. Can you tell us what is ED and what are the symptoms?
Yeah, so erectile dysfunction is the inability to consistently attain and maintain erections that are satisfactory for intercourse. Erectile dysfunction is extremely common. I think really one thing I'd like to emphasize is that most people still think about it as being a disease of like older men. I see patients in their 20s with erectile dysfunction. And so it's really important that you recognize it's not necessarily an age-related issue. It affects about 30 million men in the United States. And it's estimated that by like 2025, worldwide, there's going to be like over 300 million men affected by this. Keep in mind, these are just the people we can quantify, right? So imagine all the men who are not coming forward for us to kind of count this in terms of people that are affected by this disease. And in terms of, signs and symptoms, I think, men are pretty well in tune with their bodies when they start to have changes in their erections. And so I think when you do start to have changes in terms of not being able to maintain the erection, and if it's not satisfactory, so the definition really does incorporate something that's satisfactory for intercourse. So that sense of self-satisfaction is an important part of the of the definition as well.
Great. And I like that you mentioned the age, because I think that's very important. You think about the myths that you hear, urban legends, so to speak, especially around ED. You hear people, and I've heard people say, oh, the man, they must have had sex too much, or you don't have sex enough. Can you kind of debunk some of those theories? Does it have anything to do with sex?
No, and I think, as we start to talk more about, risk factors, I think people do, underestimate the impact of those risk factors on their sexual function. I like to tell, a lot of young guys, I'm sure, Dr. McCall, the same, things you do to your body when you're younger, they come to wreak havoc later on in life. That means even things that you are doing as a teenager can come and really illuminate themselves in your 20s. And so when you think about diabetes being one of the biggest, causes of erectile dysfunction, think about how common that is. Hypertension, we saw the opening remarks talk about cardiovascular disease. Hypertension and erectile dysfunction, these are two conditions that often go together. Because you need good blood vessels to have good erections. Those are just facts. So anything that affects your blood vessels are going to affect your erections as well. And your erections are usually the first thing to go, because the arteries and the blood vessels in your penis are so small. So if you have anything that is going to affect your blood vessels, that's usually the first sign. So I think it's just important. Holistic health is really something I emphasize, just because you want to keep those blood vessels in good shape, because they will reveal themselves pretty early and not in a subtle way.
Right. And now you mentioned hypertension, and that's also, a medical disease. People have it. But have you ever heard patients say, for example, doctor, I've got a lot going on in my life. I'm stressful. I got a new job. I lost a job. I'm just not performing. Is anything wrong with me? Do you get those questions?
I do. And I think, it's also important if you do have, changes in your erections, a medical workup is really important. And I think this is something that's also understated. I think, unfortunately, there are still many avenues for people to seek care and just not get the opinion of a medical professional. But there could be some underlying condition that's contributing that you're not addressing, that's making it worse. So, yes, things like stress, changes in your relationship, your job status. Your body doesn't prioritize sex when it's stressed out, but there are also other important medical issues that need attention that I think people often ignore. So I think it's a combination. Yes, stress adds on to it, and it's not just one cause of, erectile dysfunction. All of these things combine to, kind of lead to the condition. It's just a matter of figuring out what's going on and, kind of hitting those one at a time, or treating those one at a time, rather.
Right. And we'll talk about that. Okay, Dr. Tiffany. Dr. Denise talked about medical issues. Now, I know in the ER, you see everything. And I mean, you've seen me personally, and I can say that because you've seen me. Me as a hypochondriac, anything that goes wrong, I feel like I need to go to the ER. Okay, I want to talk about ED and ER because I know somewhere in this atmosphere and this planet, a man could not perform and rush to the emergency room because he felt like this was not normal. Have you have you ever experienced that? And what is the relationship between ED and ER?
So that's a really good question. Actually, I've been practicing like 20 years, and I have never had anyone come in with ED as their main cause or their main reason, their chief complaint. Never, not one time. But I have had people, after you talk to them about, their blood pressure or their back or why they're having difficulty urinating and these kinds of things, that eventually they say, yeah, I'm not really getting erections, or I can't keep erections, or it's just not working right. So people don't typically come presenting that way. It doesn't mean that ED isn't one of the main reasons that they're actually there. So I do give prescriptions even sometimes for PDE5 inhibitors from the emergency department, especially in people who don't have primary doctors, because really, so Dr. Denise is amazing, right? She's a whole wealth of information and she's a specialist, but most people don't go to the specialist first at all. So they will talk to someone at their gym, they'll maybe talk to a friend, maybe if they have a primary doctor, they'll get to their primary doctor. I may see them as well in the emergency department for something else, and then they get to the specialist. But the important thing to know is that I think ED, just the name itself, just we call it ED, it just sounds something bad, something kind of secretive. And no one ever wants to say that they have it, ever. If you have a talk and you have 100 men in a room and you ask who has ED, you'll get 0 hands raised. But statistically, 40% of men in their 40s, 50% of men in their 50s, and 60% of men in their 60s, and so on, have some level of erectile function. And, Dr. Denise will, attest to this. The number one reason is vascular disease. So when I see people in the emergency department with diabetes that's poorly controlled, and now they have terrible retinopathy and they don't see very well, they also have ED. I don't have to ask. I'm guaranteed that they have ED. Or someone who has really high blood pressure and they're spilling protein in their urine and they're coming in saying their chest hurts, I can almost guarantee you that their penis stopped working about 5 years before that, because it's the same arteries.
Right.
That's what no one wants to hear, but those are the facts.
Yeah.
Wow. Those are some harsh facts, but no, we need more of this education. So, Dr. Denise, I want to kind of do not a day in a life, but let's just go kind of like in order. So, a couple is having sex, and women, we're all adults who are talking about this, right? A couple is having sex. Something is not working. I know generally there's a blame game, right? Either the other partner is saying, no, it's you. And then the other partner is saying, no, it's you. Maybe you're not attracted to me anymore. Why can't you perform like you used to? So I think it kind of goes back and forth. But can you tell us like the conversations that maybe lead up to that you've seen in your practice? And also, when is it time to come to the doctor and really say, I may have a problem?
Right. And I think that's a great point. And I think, something we think less about are, the couple dynamics and the partner, right? So I think what I try to emphasize to people is that, in life, people's peak, kind of sexual interest for men and women are different, right? So you have women at a certain age starting to be perimenopausal and menopausal, men in their 20s want to, have tons and tons of sex. Our kind of peak times where we really want to have tons of sexual activity don't overlap. So I think sometimes people have a mismatch with their sexual interests. And it's not because someone is being unfaithful or uninterested. It's truly like these are hormonal driven things that really just change the dynamics of sex. I think oftentimes you do have, maybe the partner may notice, maybe the erection is not, like what it used to be. But I think a lot of people do expect that there could be a change. Maybe some, drop-offs are more dramatic than others because of those risk factors. But I think oftentimes these conversations aren't happening. I will say, though, interestingly, sometimes, it comes to a head where it's like, I'm here because my wife made me come here. Or, it's just like someone, put them in. But I think the silent sufferer is a partner. Because if you do have a male partner who has this issue, who unfortunately hasn't reached that light bulb moment of I need help, then your sex life is down the drain because this person's not seeking help, and ideally you're not getting it from someone else. So I do think that the partners are actually a big component of it, and there's actually really high rates of depression, bother, and other mental health effects if you're almost like trapped a little bit. Your partner doesn't want to get help, you can't make them go and get help, you don't want to have sex with someone else. So it is a little bit of a vicious cycle. But I do think one thing I try to emphasize is your sex life when you were in your 20s may not be the same as when you're in your 50s, and that is okay. Intimacy can change over time, and what you prioritize can also change. But I think, again, to Dr. McCall's point, there's so many things we can do for erectile dysfunction. So for that condition specifically, I just don't think it's something that people need to suffer in silence for. So I think that is just something that people should really be aware of. I forgot the second part of your question.
No, and I think this is a great question, especially around the holidays, because a lot of times we have those those fire chats, and we tell people what we're thankful for. And I think, it's a great time to say, hey, honey, we need to talk, right? There's some things going on. And I like the word help. You mentioned help because help is out there. So please, let's break down some of the options that people have, because once they get to the moment of saying, okay, I'm going to come see Dr. Denise, we need to talk. First of all, what tests are there, and how because I know that's a scary part for a lot of men. What's the technique of the test? What happens?
Yeah. So I think, like with most of the conditions we treat in medicine, I mean, you first have to really just start by talking to patients, and just figure out what's going on, because I think even just from a good history, you can, kind of start to put together what may be at play. Every patient is going to be a little bit different in terms of what that workup looks like. I think, as Dr. McCullough mentioned, and I also emphasize, like, vascular disease is really often at the root of a majority of erectile dysfunction issues. You are going to have some people that fall out of that category, whether it's, either mental health issues, nerve related issues, maybe recent surgery, other things. But for the most part, I would say, vascular issues are going to be driving that. So I think it's just first a conversation. And just, again, I really want to emphasize seeking the help of a health professional. I think a personal pet peeve of mine is that, unfortunately, between men and women, I think men are probably in general, a little less judicious with where they seek care. I call it, the gas station medications. Like, there are so many places that, again, could get all sorts of things for. Or I think, Dr. McCullough, you mentioned that, talking to your friend in the gym, the barbershop conversations. Don't talk to your friends at the barbershop if they are not physicians. And I hate to be blunt about that, but they are not the experts. And I think a lot of bad information continues to get passed between people, and it kicks the can down the road of, workup. So first, just go and see your primary care doctor. Those are really going to be your first lines of, care and treatment. They are more than qualified and able to address erectile dysfunction. I am a specialist. I still see a lot of people who get to me first to, deal with erectile dysfunction, or through referrals from my primary care, colleagues. I think lab testing really focuses around diagnosing these conditions that people may not know they have. So, are you pre-diabetic? Do you have undiagnosed hypertension? Is your cholesterol through the roof? Those are the things that you need to find out and, treat. Testosterone is another big one that affects, sexual function that, we also have to address. And that's even, with my Urological Association guidelines. That's something that we probably, don't check enough. But really basic lifestyle inquiries and modifications make a big difference. But once you get to that point where dysfunction is present, then we're talking about how do we prevent it from getting worse? And, going down that pathway. So I don't think the workup is onerous. I think that maybe a few blood tests at best, but it's often something that from conversations, all right, you have this, what are we going to do about it?
Got you. And Dr. Tiffany, I want to segue real quick from Dr. Denise, what she said. So in other words, don't go to your friend who has this magical blue or yellow pill that's going to make you stand up for 48 hours, right? And become a hero. And then you end up seeing Dr. Tiffany because you took something that was dangerous. And also, too, how does alcohol and drugs play into erectile dysfunction? Because I do know people who have sex a lot, sometimes they use things that enhance the experience. So Dr. Tiffany.
So great point, Kitty. I would say that alcohol is a mild anxiety. It helps to relax some anxiety, okay, for some people. And a glass of wine is not a bad idea. 5 glasses of wine will make you not perform like a hero. So that's the thing. It's this moderation. So alcohol, very minimal, okay. A lot, not okay. In terms of other drugs, drug use, especially opioids, long-term use, it's associated with erectile dysfunction. So it makes you not function well. Um, and I think also that it masks a lot of things. So if you have a problem and you don't recognize that you have a problem because you're always inebriated, you will kind of miss it and you don't get to take care of it. In terms of taking those pills from, the barbershop or the gym or your friend at the club, that was, maybe 20 years ago. So some of those pills are real, right? Some of those pills are real. Sometimes you'll get Viagra that's actually Viagra. Sometimes you'll get Viagra that you thought was 50 milligrams, it's really 100 milligrams. Sometimes you'll get what was Viagra but was cut with something else, and so now you have other things in your system. And sometimes you just get something that's not even it at all. So it's really, the medicine isn't that expensive. So it's worth a visit to your primary doctor or to some type of health professional if that's the route that you want to go. There are lots of different ways to treat ED. So we talk about the pills. That's one of the first things that people use. But there's a lot of other things. So you can, Dr. Janice can attest to this, but sometimes people use pills. I've had people in the ER coming in after taking a shot. So, the shots aren't typically first line. You can start them first line, but they're not typically first line. They just are a little bit more potent. And once again, with a shot, you don't know if you're getting a bi-mix, a tri-mix, a quad mix, and what kind of erection that's going to give you. So to that point, I have had people come in with priapism or, prolonged erection after taking a shot. I actually have one patient in particular who thought that he had priapism. That was his diagnosis, with a 6-hour erection, but really he had a terrible cellulitis from taking shots. And it was really, really bad, like a really bad skin infection that spread into his groin. And it was a really bad situation, completely preventable. He didn't need the shot to begin with. So I guess the point of this is see your doctor. You can get a medicine. It's not a big deal. There are a lot of other things besides pills. You can use vacuum pumps. If you're overweight, you can lose some weight. That's helpful, and a lot of other treatments. So I hope I answered your question.
No, you did. And when it comes to the pills, Dr. Tiffany, you said like most of these patients already have some type of underlying condition which causes the ED. So you have, heart disease, diabetes. Can you still take some of the pills that you mentioned, like the Viagras and the other pills that are out there, without causing further issues? Is that an option for patients?
So it's absolutely an option. You absolutely can take, the pills, the medicines, the PDE5 inhibitors, as long as you're not also using a nitroglycerin, right? Or a nitrate product to help with your blood pressure or to help with your angina or chest pain, because that causes a really significant blood pressure drop, and so it's dangerous, not a good idea. That's another thing. If you're on one of these pills and you develop chest pain, you go to the ER, you want to let someone know, hey, I'm on this pill. That's something you want to say immediately. That shouldn't be something that we have to kind of drag out of you. Another important thing, though, if you begin to develop ED and you've been on, say, metoprolol for a long time or finasteride, that's a conversation, because sometimes just stopping the medicine that you're on or adjusting just makes the world of difference. And you won't actually have ED anymore, because sometimes it can be medication induced. So really just, keeping in touch with your doctor is actually a big deal for this kind of thing.
Yeah. And I wanted to actually piggyback off of this because, and this is something that's a personal interest of me because I do research on this, but we often have a lot of issues with blood pressure medication. So there was actually a huge recent big meta-analysis that looked at all the different classes of blood pressure medications. And it's really controversial whether blood pressure medications cause it. And I think even as a urologist and all of us who have trained for years and decades, it's even in like American Heart Association guideline. This is something that people have been talking for years. And I think recently it's really kind of coming on its head, and that the disease process that affects, high blood pressure overlaps with erectile dysfunction. And so it's kind of a chicken or the egg, whether, are these medications causing it, or are are men having this erectile dysfunction that, two processes that affect the blood vessels. And so I think, oftentimes, to your point, there are some blood pressure medications that are associated with changes in erections, but I think oftentimes, or what we're starting to think now, is that, is it just unroofing someone's baseline erectile dysfunction, and they're kind of just saying, oh, it's the blood pressure medications? Because if you don't control your blood pressure, you're going to worsen your erectile dysfunction. So it's an interesting kind of, overlapping site, but I think, yeah, you have to let your, physician know. And particularly if you do feel like you have noticed a big difference with those blood pressure medications, there are so many options. There are certain classes of blood pressure medications that are actually associated with enhanced erectile function. So perhaps if you already have erectile dysfunction and it's important to you, this is an easy conversation with your primary care doc to see if maybe another option would be a better fit for you. But we see so many times people that don't even want to take medications because they're like, it causes this, when in fact, you're making things worse.
Right. So I have a real loaded question for you, Dr. Denise, because I'm sure, especially like as a wife, I would have like 100 questions going into your office. First of all, it's like, is it anything I can do? Right? Do we need to do exercises? Is he going to need a prosthetic? Do we have gels? Do we like, there will be so many questions. So can you kind of like give us, for the couples that are listening and also for people who are experiencing this, also the options when it gets to the point where it may not be, or is it reversible? And when does a prosthetic come into place, if that's even, an option?
Yeah. Well, I think you mentioned before, I mean, as a couple, really the open conversation is the first step. I think, it's important for people to be open and honest with each other of like, hey, I have an issue, and really try to get to the root of that. I think, especially around changes in couple dynamics, personally, I'm a huge fan of sex therapy. I think sometimes just having an objective, other arm in terms of helping you to reset what may be new for your relationship is important. And I think sex therapists are vastly, underutilized. I think for the visit, what you want to really, as a partner, I think support is a big thing. Erectile dysfunction really causes a lot of mental anguish, and it can be really embarrassing for a lot of men. I had a patient who said that, maybe there was one instance he couldn't perform and his wife laughed at him. I mean, I just couldn't even imagine how mortified he was in that moment, and how you completely isolate your partner by not recognizing that this is like, it was terrible. I was just like, oh my gosh, but I just want to be supportive. It's just like, hey, I understand this is not, a fault of your own. Like, this has happened. What are we going to do? And I think just being supportive that there are options that work. And I think you just have to see what you're comfortable with, and, what's open to you. Actually, as of a couple of years ago, all of the kind of options for ED are actually considered first line. For a long time, we had what we called kind of like the stepwise approach. And I think most people will still start off with the pills. I mean, I think in practice, often people are, that's kind of, the lowest hanging fruit. But if I have a patient who comes to me who's done research on, a penile prosthetic, which is actually considered the gold standard for erectile dysfunction, if he's done his research, I think he's well informed and that's what he wants to do, there would be nothing medically or ethically wrong with that. It actually is now considered first line or on par with someone coming in who says, maybe I want to do the shots or the pills. So it really is a conversation, and it really just depends on what you're comfortable with. I think not to get into too much detail, but also every option comes with its pros and cons. Like, for example, if you have, bad hand dexterity, you're not going to be an ideal candidate for injections if you can't really inject yourself. Same thing with the penile prosthesis. You need to be able to, pump that device up. Pills, if you have other conditions that are contraindicated. So I think we can usually find, a solution. But all in all, from a partner's perspective, I think it's important for you to be supportive, be aware of what the science is around how this affects men, but also recognize that your sexual health is also a priority. So you shouldn't have to suffer if with a partner who may not want to seek that help. So it's a two-way street.
Thank you. And Dr. Tiffany, we know you have Calisthenics Med Spa, where you treat both men and women when it comes to sexual health, but primarily because we're talking about men today. Can you talk about the P-shot and also the wave lymph. What is it? Wave. I was going to say wave lymph. I don't know. I'm thinking about lymph, but wave therapy.
Shockwave? You're talking about shockwave?
Yeah, the shockwave. Hey, while we're on the conversation of lymph, come on now. Anyway, length and strength, right? Go guys. But yeah, so can you give us some information about those treatments that you have at your center?
Kitty, I just love you. You're just so so funny. Okay, well, all right. So there are a lot of Dr. Denise we'll see kind of those cases where people are kind of ready to go all in. Sometimes a penile prosthesis is the answer. Even when people come to see me, I say, there's not really much I can do to help you. And this is the best way to go. This is going to be your best bang for long term. However, sometimes it's not. And I think that in terms of intimacy, sometimes people don't have all the information that they need to make really good decisions, and they don't get it in time. So what do I mean by that? People with prostate cancer or post-surgical, right? There's going to be some level of changes in erection and sexual function that happen with those kinds of surgeries or treatments that what I see in my practice is that people aren't really aware of. And so we help on the other end of it. Additionally, the first line treatments, as Dr. Denise mentioned, are going to be everything essentially that she does, right? So everything on the gambit. So it's like the vacuum therapy versus the pills versus the shots versus, right? So you can do everything. Then there's like this whole other side of things that are more in development, right? So at one point, PRP was considered foolery. Stem cells were considered foolery. Fast forward, people get better with stem cells. People, you have a knee injury, you get a PRP shot, it puts you on the road to recovery as opposed to a knee replacement. So PRP is basically, we draw your blood, it's platelet-rich plasma, we draw your blood, spin it down, re-inject it into sites anywhere in the body. Dentists have been using it for years and years to help with areas that don't have great vasculature or don't have a lot of blood supply. And orthopedic doctors use it as well. And so I use that in sexual wellness. So some of the things we do here that are really quite amazing are, PRP. We also do shockwave therapy, which is more kind of a European model. I find it effective in the right person. So sometimes it'll change people who were not responding at all to the pills anymore, then they become responders. Or people who now have to take the pills to get any type of response, they don't need the pills anymore on a regular basis. So those are some of the things we do. We also use hyperbarics. I find that because the primary issue is vascular disease, especially with like diabetics and people that have hypertension long-standing, so those blood vessels aren't carrying the oxygen very well, right? So then if you think of this whole cycle as like a nitrous oxide issue, you need more oxygen and oxygen carrying capacity, and that's what hyperbarics does. So if you're familiar with like dive injuries, and most people in South Florida kind of are familiar, right? So what happens? You dive deep, you get nitrous oxide, it builds up, you come back up, it gets bigger, and then you have a big, huge problem. You go rush to the hyperbaric chamber in our local area. It's at St. Mary's. But what it also treats is people with like diabetic wound infections, foot infections, or breast flaps that don't heal, those kinds of things. So anytime you need extra oxygenation to your tissue, that's what you use hyperbarics for. So think about the diabetic. Why do they have problems in their eyes? Why do they have problems in their penis, their toes? They don't have the oxygen carrying capacity because the vessels are so damaged over time from the endothelial damage you can get with high sugars or high blood pressure. So that's the kind of stuff that we do here, more of from a regenerative standpoint. But yeah, it works, and people are happy. Some of the newer things, I don't know if you guys do this at all, if you read any of the research, Dr. Denise, but Botox. So I've been using that in my practice, actually with pretty good success. And it just helps to kind of relax those muscles kind of all the time, so that instead of taking a pill every day to kind of relax the muscles for a short term, it's like a 6-month kind of relaxation. I think that as time progresses, we'll see more of these kinds of therapies becoming more talked about, more mainstream. But it's just a matter of time. And I also think a really important thing is that in this country, because we have the epidemic of obesity, the epidemic of hypertension, the epidemic of diabetes, unfortunately, we will continue to see more erectile dysfunction at a younger and younger age because these diseases are starting much earlier than they did historically.
Right.
And
And I
are
just
any? Oh, go ahead.
Oh, no, I was going to say, I wanted just to commend you because I think that there's so many people that are not going to find your Dr. Tiffany's, right? Like you are, or said, like it's not an option for everyone. And I think that's what's important, right? Like there's so much exciting work in, the field of erectile dysfunction. And we don't know where we're going to be in 5 years. 5 years ago, some of these things weren't options. And this is like a rich area of research. But I think, unfortunately, the poorly matched, patient to, someone who's not giving this information. And I think that's why this has become so predatory. So I just love the fact that you're just like, hey, these are options. It may not be the best option for you, but I think some people sell these options as it being an option for everyone. And it's really important that you have to look and see if you have diabetes, hypertension, heart disease. I mean, if you have like 4 different things, some of these options are really probably not going to work because you may be past the point of no return in terms of your vascular health. But I think out of the need for people not wanting to really feel like they're fully intervening, I think some people play on that. So I think, for those in Florida and those nearby, you want to have someone who's well informed to be able to guide you honestly about those, those options.
Great. And I know we're going to have commercial break in about a minute, but I want to have you ladies think when we come back to some realistic things that we need to tell our viewers, because I know people who want results instantly. So they have the problem, they come to you, they get these treatments. How quick does it work realistically? Is it something that happens that night? No pun intended. But, I want to kind of get into those answers when we come back from our commercial break. And also, we did have a question from one of our viewers in regards to a gel. It was from Mike. How safe is testosterone gel with supplementation? So when we come back from commercial break, if we can answer those questions. And also, how can we prevent ED if that is all possible?
Great question. Wow.
Vital Vita Wellness offers a variety of services to help with your weight loss journey. We provide a full health evaluation and physical exam. Our weight loss program is tailored to each individual. Our weight loss packages include full body measurements, blood work, EKG, appetite suppressant, nutritional supplements, nutrition counseling, exercise planning, B12 injections, vitamin infusions. We also have minimal invasive treatments such as ultrasonic cavitation, laser lipo, and liquid lipo to get you looking and feeling good. We have a professional, medically trained staff that cares about you reaching your goals. Don't delay. Get started today. Book at www.vitalvitawellness.com or call 561-247-7732. Vital Vita Wellness. Don't delay. Get started today.
Unmute myself. Oh, we are back. And we did have another question. They're coming in now, ladies. So hopefully you remember what I said. I know I talked very quickly, but Dr. Denise, we'll start with you. In regards to the gel, are you familiar with that gel?
Very. I do a lot of testosterone replacement.
Okay.
Yeah. So I think with testosterone, and this is something I really emphasize for guys to be careful with, you really shouldn't be taking just testosterone unless you are under the care of a medical professional. And that's because testosterone, although it has a lot of benefits, it's directly linked to erectile function, sexual function, mood, cardiovascular health is good for that. But it can actually drive up the production of your red blood cells. And so if you are actually not under the care of a physician, you may put yourself at risk for blood clots. So please, over the counter, and I know, again, these are things that are really easy for people to get for some reason, things with testosterone in it, but you should not be getting it. These are things that require regular lab checks to see how you're responding to it, to see what your blood counts look like. So this is not a benign medication. It is safe under the care, as I mentioned, of someone who's tracking this and making sure that you're doing okay on it. But it really is meant for men who have testosterone deficiency. And that's something that you 100% don't want to be getting from your friend at the gym.
the friend at the gym is actually the enemy. I'm learning this more
It is.
on this show. So we got a question.
So
We got a
being
question
honest,
from.
I have a lot of patients that come in with the same friend at the gym and they're taking shots. You
Yeah.
know, I've seen abscesses in the ER from testosterone shots, like
Mhm.
really, really crazy. But then the biggest thing is I see people with breast, right? Like it's not unopposed. More is not always better. You don't want to
Right.
go up and up and up on your testosterone because it converts over, right, to
Yes.
estrogen. So that's
Yeah.
a big thing. So you need someone checking your levels. Don't just do it by yourself. Um,
Right.
the other part of that is that when people use this kind of therapy, which is not bad. It's good. It can be really, really good. But to your point, Dr. Janice, geez, the hematocrit to 17. Like you've got someone's got to be monitoring this stuff. As I tell people, listen, it's better to do it with a doctor. If you're not going to do it with a doctor, then try to donate blood like every 6 months, every 3 to 6 months, so you do not get like kind of this really thick blood that sludges and stuff. Really big deal, huge deal.
Yeah. And what a lot of people also don't know, and I see a lot of people, I said the other half of what I do male infertility. Testosterone kills your sperm count. So for my younger guys who may be getting this from someone at the gym, if you are having problems having, children, it's the testosterone you're taking. And I think that's also something that is considered just a major, faux pas in terms of information. So I think, unfortunately, if you're getting it from people who don't know this, you may not know that fact, but testosterone should not be taken in any form if you are actively family planning.
Okay, thank you. And I have another question from the audience coming from Jeffrey in regards to the implants and the pumps, and are there good brands and models? I'm like, is that that's like shopping for a car? Can you do that? Like, I want the Eon 250 version. I mean, ladies, help me out. Somebody must be doing some Christmas shopping soon. I don't know, but can you please let us
Yes.
know? Are there models out there that we need to know about? And does it change the girth? And here's a loaded question. Okay, please take it, ladies. Please.
I will keep it simple. I'll probably take this one. I do these surgeries, so I can give some context to this. So the penile implant is considered the gold standard for erectile dysfunction. It is a surgery to treat erectile dysfunction. Essentially, it's an entirely internal device that replaces your cavernosal body is a fancy term. Those are the two parts of your penis that fill up with blood when you get an erection. Okay, so your erectile bodies. So this is an entirely internal device that basically replaces that with an inflatable silicone device that's internal. The second component of that device is a pump that actually sits pretty discreetly in your scrotum. And then a third component that serves as what we call a reservoir that sits in your abdomen. This basically contains saline, and essentially how it works is a closed system. So every time you pump up the device, the saline from that reservoir is going into the inflatable portions, these silicone bodies that are now replacing the internal part of your penis. And so it allows you really to have a 10 out of 10 erection, on demand whenever you want without affecting sensation and other things. And, it has really high success rates as well as high satisfaction rates. Greater than 90% of people report really high satisfaction rates with this, but it's truly the only thing that pound for pound is going to fix, erectile dysfunction. It is a surgery. And although, it's not up there with heart surgery, it is a surgery. And so this is something that, you still have to be safe enough to undergo surgery because it is an implant, another device, and it's a prosthetic. I would say, as someone who places this, we are very selective about who gets these surgeries. The number one thing that keeps me up at night are infections with these devices, and of course, different nuances with with patients. But it works really well. I would say, the two kind of top brands, even though I know there's some coming out on the market, are going to be your Boston Scientific and Coloplast. Those are like the two primary companies that make this implant. Really, the decision is based on your urologist, different, again, patient factors. But those are the two main companies I work with, both, and both great companies. What I would like to emphasize with penile implants, though, it's not like breast implants where, I can go in and now become a triple F if I wanted to. If you put your penis on stretch, that's as far as it can go. Like, there's nowhere else for things to go. I will say with the implant, you can, push a little bit and, probably help a little bit on the length and girth side. And this is, again, where kind of decision making and different devices. This is where your urologist decision making comes into play. But you should be getting an implant because you want to fix erectile dysfunction. We are trying to get you to have a satisfactory erection. We're not trying to get you to have a 2-foot penis. I mean, that's not the goal, because there literally is not enough space to do that. So I think this is also something where the education around it, it's not how we think about breast implants where you can really, really augment. You don't have that degree of freedom, with the penis.
Right. Well, I think if you had a 2-foot penis, you would have more worries than anything, because I don't think you would have anyone.
I couldn't think of a better example.
You would have no worries because you would have no one who wanted you.
You'd have no friends, right?
Yeah.
No
So doctor, we have a question in regards to the carnivore diet. I know we didn't really talk about more, diet, but can we kind of get into that? Because for people who don't have it, they're like, I don't want it. Is there anything I can eat? Or for people who do have it, they're like, what can I do to maybe reverse it? Or they're thinking maybe my diet. But what advice do you have for diet? And I'll ask both of you this.
I was talking a lot, so I was going to let Dr. Tiff take it.
Yeah, I mean, it's fine either way. I really just think a healthy diet. So like the things that you think are healthy, like to not the bag of Oreos, not, 10 martinis, you know what I mean? So kind of like saying that straight and narrow. It doesn't have to be a paleo diet only. It doesn't have to be a vegan diet only. It has to be a diet that's going to keep your arteries clean. So if you want to think of it, maybe the same kind of diet that you would do for your heart, right? Mm-hmm. So because we're just talking about vessels. And then if you do have any issues with diabetes or elevated blood sugars, which you would know by getting a hemoglobin A1C check, not just the way you feel, because you may feel fine walking around, like a sugar baby, you'll feel okay until you don't. But, if you have those kinds of issues, then, doing some glycemic control. So maybe a couple of years ago, it was like, no fat, no fat, no fat, and all the diets, and then everything was sugar, 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 and everyone got bigger, bigger, bigger as opposed to smaller, right? Because it's so much sugar. So that's one thing I think is like kind of a lower glycemic index to your diet. And when I say diet, I don't mean latest fad. I mean the way that you eat in general is helpful. Additionally, what I find in my practice, we help with medical weight loss here, because it makes a big difference in erections, right? So if you are 100 pounds overweight, one, you can't see your penis very well. So you think that it's really small, but it's not necessarily. You don't necessarily need an augmentation or expander. You just need to lose a little weight. So that's one. The second thing is that if you are really, really overweight and you can't get up a flight of stairs easily and you can't get in and out of your car, you can't have good sex. Right? And you can't have sustained sex because your heart can't handle it. So losing that weight actually allows you to have better flow to your penis vasculature, which makes better erections. So sometimes the treatment is just helping someone lose a couple pounds.
Right. And I think, just thinking about, like, I think to your point, just like moderation, right? I never am going to, tell someone not to have their favorite drink or something, but there's a difference between having 3 martinis in a week and having 3 in an hour, and I think you just want to kind of measure yourself a little bit. Probably to direct the carnivore diet, I think, again, I don't really advocate for anything strong from a diet standpoint. I think, a good balance of, your fruits and vegetables, and like you said, a vascular, healthy diet. The carnivore diet, the little I know about it, red meat is going to clog up your arteries, which are going to also, kind of lead to, definitely going to lead to heart disease and erectile dysfunction. So I think having a balance with everything, if you do like your, red meat, please try to incorporate some fish and some other things and some other sources of proteins. But a very heavy red meat diet is going to lead to a lot of other medical issues. So I think even if someone has lived till 70 with with this carnivore diet, I don't think there's a lot of people living to that point focusing on a high red meat diet. So just the balance is definitely important.
Great. And we have 5 more minutes left. I can't believe this conversation flowed so quickly. So we did cover diet. I want to just make sure we have one last question from one of our audience members as a sickle cell patient who dealt with, is it priapism? Okay.
Priapism, yeah.
Priapism. Okay, tongue twister there. In developmental years, is there a possible connection between then and now regarding ED?
There is, unfortunately, and I think, I know that my sickle cell patients suffer, quite a bit. I know Dr. Tiffany, I'm sure, sees a lot of them as well. Yeah, and this is something where, if this has become an issue, especially during your teenage years, puberty years, it really will be great to get looped in with the urologist. We actually do have some pretty good treatment regimens to help our sickle cell patients minimize the instances of priapism. So priapism is an uncontrolled, prolonged, an unintended prolonged direction. And in sickle cell patients, it happens because the blood vessels are shaped a little bit differently. They get stuck in these blood vessels, and that's what causes almost like a blockage in this prolonged direction. But essentially, counterintuitively, thinking about ways that we can kind of optimize that flow so that things don't get quote unquote stuck, that's actually a great way for us to minimize those episodes. But some people really do suffer from this. The long term of having these episodes and really not treating it appropriately is that over time you can actually get damage in that erectile tissue in your penis. And so for men that are having erectile dysfunction later, it's because your machinery has been damaged through the years. And so I think this is probably really an underaddressed area of research and treatment overall, but we do see a lot of it. So yes, if you have yourself or anyone else, please go and see a urologist, because this is something we could definitely help with.
And one last question really quick. We do have a global audience. Are these treatments generally available worldwide? Does anyone know?
Yes.
Okay, that was
Yes,
from Anicia from Jamaica. So she wants to know, get her Jamaican men in check. Yes, Anicia. So ladies, before we end, because we really have only 2 minutes left, Dr. Denise, tell us real quick how we follow you and continue to see all the wonderful things that you're doing.
Yeah, I'm pretty I'm pretty big on just patient and public education. So you can follow me on Instagram, Dr. Denise _official. So that's DRDENISE _official. I also have a website, www.drdeniseofficial.com. That's DRDNISEOFFICIAL.com. If you like Twitter, I'm there too. My Twitter name is a little different, but it's Dr. Denise and just an underscore without the official. So please find me. But yeah, I usually post lots of good information. So you can keep, stay tuned.
Okay. And Dr. Tiffany McCullough, let us know how we can follow you and more about Calogenix Med Spa and number, all that good stuff.
Yeah, so we have a website as well. So it's www.calogenix.com, CALLAGENICS.com, and on Instagram, Calogenix _Palm Beach, and Facebook. And yeah, we're local. So if you're down here in South Florida, sunny Florida, come by, say hey. Yeah, but that's it. I am really, really passionate about, I know that this is just a male talk, but I'm passionate about the relationship, because oftentimes what I see in my practice, the guy will come in saying they have the problem, but it's not only the guy, it's a relationship problem, right? So there's a mismatch somewhere, and it happens a lot. So anyway, that's why we try to help intimacy here.
All right. Well, I want to thank you, Doctor, so much. Thank you, audience. Thank you, future audience who will see us later. And remember, we talk about physical health, but mental health is also very important. So we have 3 numbers. You can dial 988 if you have anything that you want to talk about. It's a mental health hotline. Very important. Happy holidays, everyone. The next time we'll see you, we'll be in a brand new year. I can't believe that we're seeing this, 2023. And we will see you later. So thank you for joining My Health Matters. And we have our final remarks by the beautiful Justine Hampton. Take it away, Justine.
Thank you. On behalf of Global Health and Community Service, Inc., we thank you for attending today's webinar. We would also like to thank our esteemed guest speakers, Dr. Tiffany and Dr. Denise. Of course, our resident host, Ms. Kitty London, and Mr. C. Ron Allen and the production company KOP Mentoring Network. Without each of you, this event would not have been possible. During this season of giving, please remember Global Health and Community Service, Inc. We are a 501c3 organization that is committed to conducting programs, seminars, workshops, and structured events that educate, reinforce, and inform the public on health-related issues that impact and prevent healthy lifestyles. You can make your tax-deductible donation by visiting our website at www.global.org. global.ghacsi.org and clicking on the donate button, or mailing a check to Global Health and Community Service Inc. at P.O. Box 18161, West Palm Beach, Florida 33416. If you shop through Amazon, please consider adding Global Health as your charitable organization through Amazon Smile, where for every purchase you make through Amazon, Global Health will receive a small donation. Once again, thank you, stay well, and happy holidays.
Thank you, Justine. And our final video that we have for you today is by Darren Tostin. Thank you.
On behalf of the 7th District's Florida Statewide Organization of Omega Psi Phi Fraternity Incorporated, I want to thank you, Dr. Denise and Dr. Tiffany, for taking time out of your schedules and bringing your expertise to this program today. To our partners, Global Health and Community Services, we can't thank you enough for this partnership and the hard work that your team has put in, along with our Health Initiatives Committee. I also want to thank you, Ms. Kitty London, for bringing such professionalism and enthusiasm to all these programs. And finally, I want to thank our guests for tuning in, not just on today, but to all our previous topics, 9 in total so far. And we hope you join us on January 14th for our online health fair. Thank you.